Welcome to the skill demonstration of phlebotomy, also known as venipuncture, brought to you by Northwell Health's Institute for Nursing. Before the demonstration begins, let's review some important points to remember when performing this procedure. First, check the patient's isolation status. If on isolation, follow system policy. If not on isolation, follow standard precautions. Also, check for patient allergies. Before entering a patient's room to do a blood draw, remember to double check the order and match the printed patient labels against the order. Then collect the needed supplies, which include a specimen transport bag, a tourniquet, vacutainer, straight needle, alcohol pads, gauze, tape or band-aids, gloves, and the appropriate blood tubes. Always checking expiration dates and making sure seals are secure. If blood cultures are needed, bring a ChloraPrep and follow site policy as to who may draw the specimens. Additional points to remember include tourniquet safety. Do not leave the tourniquet on for more than 1 minute, and do not place the tourniquet under the gown, making it invisible. Remember, if you enter a room with the tourniquet, be sure to leave the room with the tourniquet. Always ask your patient about arm restrictions. For instance, a mastectomy, AV fistula, AV shunt, etc. Following the order of the draw is imperative. It prevents cross-contamination of additives in the blood collection tubes. Check your site for the location of the order of the draw chart. Now let's talk about straight needle versus butterfly needle. When using a butterfly or a winged infusion set, and a blue-topped coagulation tube is the first tube to be drawn, you will need a discard tube to purge the air from the infusion set. The discard tube is used to prime the tubing of the collection set to maintain proper blood anticoagulant ratio. The discard tube should be either another blue coagulation tube or a tube with no additive. When using a straight needle, there is no need for a waste tube. A straight needle also has been shown to reduce hemolysis and is the suggested Northwell collection method. Skin disinfection. Uses circular motion to disinfect the skin when using an alcohol pad. If using a ChloraPrep, use an up and down friction-producing motion. If your patient is allergic to chlorhexidine, follow your site policy. Blood cultures. Remove the cap and clean the aerobic and anaerobic culture bottles with alcohol prep and leave the pad on the bottle top. Aerobic, the blue top bottle, goes first, and then the anaerobic bottle. The total amount of blood needed for each of these is 8 to 10 milliliters for an adult. If you are unsuccessful accessing the vein on your second try, request someone else attempt the third time, and after the third attempt, communicate and escalate. For more information, please refer to the system policy and competency located on the Northwell Health intranet. Welcome to part 2 of the skill demonstration of phlebotomy. First, verify the order and check the patient labels against that order. Gather the appropriate supplies and equipment and perform the 5 I's, introducing yourself with your name and title.
Mrs. Smith, my name is Shobha. I'm a registered nurse.
And perform infection control.
Mrs. Smith, I'm going to wash my hands.
Identify your patient.
Mrs. Smith, can you state and spell your first and last name?
Francis Smith. Francis
And your date of birth?
March 17, 1927.
Very good.
Inform the patient of what you will be doing.
Mrs. Smith, I'm going to take some blood from you.
And the fifth I is include the patient. Check and verify limb restrictions and allergies.
Mrs. Smith, do you have any arm restrictions?
No, I do not.
Okay, do you have any arm preference?
Yes, I much prefer the left arm. They seem to be more successful there.
Okay, so I will use your left arm.
Create a clean work environment at the bedside and set up the equipment. Put your tubes in the blood draw order. Apply the tourniquet 2 to 4 inches above the anticipated site of venipuncture. And palpate for an appropriate vein. Once located, remove the tourniquet. Remember, it cannot be left on for more than 1 minute. Don clean gloves. Cleanse the site with an alcohol pad in a circular motion, beginning at the anticipated puncture site and working outward. Allow the area to dry. No blowing, fanning, palpating, or wiping over the site. Attach the vacutainer to the straight needle or butterfly. If using the straight needle, always remember it's clear to clear. Hold both the green and pink portion of the straight needle device while removing the clear cover to attach the straight needle to the vacutainer. Reapply the tourniquet. Pull the pink needle safety device straight up and remove the green cap, ensuring that the bevel of the needle will be facing up. Use the thumb of the non-dominant hand to anchor the vein from below and pull the vein taut. Be sure the anchoring thumb is well below the puncture site to not interfere with the angle of the approach and not to stick you. Always inform the patient before sticking.
Mrs. Smith, you're going to feel a little stick.
Using the dominant hand, insert the needle at a 15 to 30 degree angle into the vein and then lower the device. Secure the vacutainer and insert the first blood collection tube. Be sure to hold each tube in place so it doesn't pop out. Follow the order of the draw when collecting the blood specimens. Invert tubes at least 8 times so that the blood will mix with the additives. When the tubes are filled and the last tube is removed, release the tourniquet. After removing the needle, place a gauze pad over the needle insertion site and apply pressure to stop the bleeding. Engage the needle safety device on a firm surface as soon as the needle is withdrawn. Apply pressure to the site for 2 to 3 minutes. If the patient is able to apply pressure, allow them to do so. If the patient is on anticoagulants, apply pressure for 5 to 10 minutes. Dress the site with the appropriate dressing. Discard the needle device in the sharps container. At this point, remove your gloves and wash your hands, as the gloves may have become contaminated with blood or bodily fluids. Label the tubes at the bedside and have the patient verify correctness. Time and initial the labels following site policy.
Mrs. Smith, can you check this label for me?
Yes, that is me. Thank you.
Very good.
Place the specimens in the biohazard bag along with the order slip. And send the specimen to the lab immediately. Thank your patient upon leaving.
Mrs. Smith, is there anything that I can help you with?
No, I'm good, thank you, Shobha.
Very good.